All right, let's talk about something that millions of people go through every single year, but very few of us actually understand. We're going to go behind the mask and explore the world of anesthesia, not just as a quick medical procedure, but as a whole journey, a really carefully guided experience from the very beginning to the very end. I mean, it's the big question, right? That moment where you just have to surrender to trust this team of experts as your consciousness just fades away. What is actually going on inside your body and your brain? Okay, let's get into it. At its heart, modern anesthesia is a flat-out medical marvel. It's the silent, totally essential partner in pretty much every operating room out there. It allows surgeons to do these incredibly complex, life-saving things that would just be unimaginable otherwise. It really does make the impossible possible. So what is it exactly? Well, the official definition calls it a controlled, temporary loss of sensation or awareness. But it's so much more than just being asleep. Depending on what's needed, it can mean pain relief, muscle relaxation, amnesia, so you don't remember anything, and of course, unconsciousness. So where does this journey begin? It's not actually in the operating room. It starts way before that, with what you could argue is the most important phase of all, getting ready for the procedure. You have to understand, anesthesia is never a one-size-fits-all kind of deal. Your anesthesiologist is tailoring a plan specifically for you. And that all kicks off with a really detailed pre-op assessment, where they look at your medical history, your lifestyle, your physical condition, all to make sure any potential risks are as low as they can possibly be. To get a handle on that risk in a standardized way, medical pros use something called the ASA classification system. It's a 6-point scale that gives the whole team a quick snapshot of a patient's overall health. It goes from ASA 1, which is a totally healthy person, all the way up to an ASA 5 or 6 for patients who are critically ill. And this chart really drives home why that ASA score matters so much. You can see it right there. As the ASA status goes up, the risk climbs, and it climbs dramatically. So here's the key takeaway, and this is really important. The single biggest factor in how risky anesthesia is, well, it isn't the anesthesia itself. It's how healthy the patient is before the surgery even begins. Okay, so once that whole assessment is done, the anesthesiologist gets to choose from a whole spectrum of tools to build out the perfect plan for you. You've basically got 3 main categories. First, there's general anesthesia. That's the one most of us think of, where you're completely unconscious. Then there's sedation, sometimes called twilight sleep, which is a lighter touch to make you relaxed, maybe a little forgetful. And finally, you've got regional anesthesia, which is wild because it blocks the nerve signals from just one part of your body. You can be totally awake and not feel a thing in that specific area. And the precision you can get with regional anesthesia is just remarkable. They can use tools like ultrasound to hit a single specific nerve and numb just your arm, like you see on the left. Or they can do a spinal or an epidural block, like on the right, which numbs a much bigger chunk of your body, all while you can stay awake if you want. Okay, the plan is locked in. Now we're heading into the operating room. This is a place where technology and teamwork all come together for one single goal: keeping you safe. The modern anesthesia setup is basically a high-tech command center. I mean, from the anesthesia machine itself to all the monitors, every single piece of equipment has these built-in fail-safes. They're all designed to slash the odds of any error and make sure everything is delivered in a steady, controlled way. But all that amazing tech, it's only half the story. The other half is the human element, and it is absolutely vital. There is always a highly trained, super vigilant anesthesia provider, an anesthesiologist or a nurse anesthetist right by your side continuously for the entire procedure. You are never, ever alone. And that provider is watching everything. Seriously, they're tracking your heart's rhythm and rate, your blood pressure, the oxygen levels in your blood, your temperature. They're even analyzing the exact mix of gases you're breathing in and breathing out. It's just this constant flood of data that gives them a perfect picture of how your body's doing, second by second. So the surgery is over, it was a success. Now we get to the final part of the journey, waking up. And this process actually has a name. It's called emergence. Emergence is that transition period, going from being anesthetized back to being conscious. And as your body and brain are kind of coming back online, it's pretty normal to feel things like shivering as your body warms up, or to be a little groggy, confused, maybe even nauseous. It's all just part of your body's natural process of readjusting. What's really fascinating, though, is what's happening in the brain. Researchers put it perfectly. Waking up isn't just about the drugs wearing off. It's more like the brain is actively finding its way back. navigating all these different brain states to get back to normal. To put it simply, your brain literally reboots itself. And here's something you probably didn't know. Even though the goal is unconsciousness, your brain can still be pretty active. In fact, about 22% of people actually report dreaming while under general anesthesia. And in incredibly rare cases, we're talking like 1 or 2 people out of 1,000. A patient might experience some level of consciousness. It's a phenomenon called anesthesia awareness. With all this incredible safety and precision and science, it can be really easy to take it all for granted. So for our last section here, let's just take a step back for a second and appreciate how absolutely revolutionary all of this truly is. I mean, the search for painless surgery is ancient. It goes back thousands of years to the Sumerians using opium poppies, all the way to the Middle Ages with these soporific sponges soaked in things like opiates. But the modern age really kicked off in 1846 at a place called the Ether Dome in Boston with the first successful public demonstration of ether. The progress from that day to today has been just astounding. How safe are we talking about? Well, this number really says it all. The rate of death that can be blamed on anesthesia alone, so totally separate from the surgery or the patient's health, is just 1 in over 185,000. That is an absolutely incredible safety record. And this is where it all started. This image is from 1847, and it captures one of the very first surgeries using ether. Just look at it. The crowd of people watching, the formal clothes. It is a world away from the sterile, high-tech operating rooms we know today. The jump from that crowded room to the standard of care we have today is nothing short of a transformation. Anesthesia didn't just get rid of pain, it unlocked the entire potential of modern medicine. It really makes you wonder, what's next? What kind of innovations are going to define this journey another 100 years from now?